Moai na baby.
Hello mga kaPTids! I am Kirsten and I will be your speaker for today's episode of the Moai series. This episode is about the muscles connecting the upper limbs to the vertebral column. And these are the Trapezius, Latissimus Dorsi, levator scapulae, rhomboid minor, and major muscles. Now let's get started. Disclaimer, the pictures and illustrations used in this video are from the Netter's Atlas of Human Anatomy. Before we proceed to the Moai now, we will be first discussing about the different bony landmarks in the skull, cervical and thoracic vertebrae, scapula, and humerus that serve as the point of origin and insertion of the muscles of the upper limb to the vertebral column. In the skull, the occipital bone is found at the posterior and inferior portion of the head, and it serves as one of the origins of the trapezius muscle. In the vertebral column, we will be discussing about the cervical and thoracic vertebrae. The cervical part of the vertebral column consists of 7 vertebrae, while the thoracic part of the vertebral column consists of 12 vertebrae. These vertebrae compose of 2 processes, which serves as the attachment of ligaments and muscles. The spinous process, or the spine, is located posteriorly between the laminae. The transverse process is located laterally between the junction of the laminae and pedicle. The levator scapulae is the only muscle that originates solely from the cervical vertebra, specifically from the transverse processes of the first 4 cervical vertebrae. The 2 muscles that expand its origin from the cervical to thoracic vertebrae are the trapezius and rhomboid minor. One of the origins of the trapezius is the spines of the 7 cervical vertebra to all the spines of thoracic vertebrae, while one of the origins of the rhomboid minor is the spines of the 7 cervical vertebra to the first thoracic vertebra.
Yeah.
The trapezius muscle is also known as the shoal muscle and has 3 fibers, which are the upper, lower, and middle fibers. The individual actions of these 3 fibers will be discussed in the latter part of the video. The muscle that originates solely from the thoracic vertebrae are the Latissimus Dorsi and rhomboid major. One of the origins of the Latissimus Dorsi is the spines of the lower 6 thoracic vertebrae, and the rhomboid major originates from the 2nd to the 5th thoracic spines. In the scapula, we will be discussing 4 landmarks: the medial border, the inferior angle, the spine, and the acromion process of the scapula. We have discussed both the medial border and inferior angle at the past episode. The medial border is the medial rim of the posterior scapula, and it is where the levator scapulae and rhomboid inserts. The inferior angle is the tip located at the inferior aspect of the posterior scapula, and it is one of the origins of the Latissimus Dorsi. The spine of the scapula is located posteriorly, and it forms a bony prominence at the back. The acromion process is located at the lateral end of the spine of the scapula. The lower and middle fibers of the trapezius inserts at these 2 landmarks. The bicipital groove of the humerus, which divides the 2 tuberosities, is the insertion of the Latissimus Dorsi, specifically at the floor of this structure. The clavicle, also known as the collarbone, serves as the insertion of the upper trapezius muscle. Other bony landmarks that should be mentioned are some of the remaining origins of the Latissimus Dorsi, which are the lower 3rd and 4th ribs, and the iliac crest, which is located at the pelvis. Other soft tissue structures that serves as one of the origins of the muscles in this compartment are the ligamentum nuchae and lumbar fascia. The ligamentum nuchae is one of the origins of the trapezius and rhomboid minor. It is a ligament that covers the spines of the 1st to 6th cervical vertebrae, while the lumbar fascia is one of the origins of the Latissimus Dorsi. We have already discussed the origin and insertion of the muscles. Now we'll proceed on tackling the nerve supply and the action of these muscles. The dorsal scapular nerve innervates 3 muscles: the levator scapulae and the 2 rhomboids. The levator scapulae is also innervated by the C3 and C4 along with the sensory portion of the trapezius. The motor portion of the trapezius is being innervated by the spinal part of the accessory nerve. Lastly, the thoracodorsal nerve innervates the Latissimus Dorsi. We will be dividing the action based on the two structures, the scapula and the humerus. The Latissimus Dorsi is the only muscle in this compartment that moves the humerus. It performs arm extension, adduction, and medial rotation. And in fact, Latissimus Dorsi is also known as the swimmer's muscle because its action is associated with swimming. The remaining muscles move the scapula. The levator scapulae and the two rhomboids elevate the medial border of the scapula. The rhomboids raise this landmark upward and medially. The trapezius has three fibers as mentioned prior. The upper fibers elevate the scapula, the middle fibers pull the scapula medially, and then the lower fibers pull the medial border of the scapula downward. So here are some tips to remember the moina. The first tip is to always remember that trapezius has three fibers, which are correlated to the action being produced. For example, lower fibers pull the medial scapula downward. The second tip is to remember the mnemonics Laroyotara, which are levator scapulae, rhomboid, and upper trapezius. These are the muscles that elevate the scapula. The third and last tip is to always analyze the name of the muscle. For example, the levator scapulae. Its name indicates that it elevates the scapula because of the word elevator. We have reached the end of the video and I hope that you can use this knowledge about the muscles connecting the upper limbs to the vertebral column in your studies. Like and share this video and don't forget to support our partners. And yes, that's all. Thank you.
Yeah, it's Moana, baby.